as direct and as upfront as I can be, given what we know today. And I just want to get rid of any speculation about us living with this variant. We cannot live with this variant. No place on earth has it, and no place on earth has, unless they have their vaccination rates much, much higher than what we do, because otherwise it subjects the population to thousands of hospitalisations, thousands of deaths. And I know that we're a bit complacent. There's a lot of commentators who argue it's not a serious disease. It is a horrible disease. It affects people of all ages, and this variant is, as Dr. Chant said, she read out the number of people in intensive care and their ages for a reason. Young people are having to be admitted into intensive care, as well as older Australians. And we have to be aware of that. We can't be complacent. And again, if we see images overseas of some countries living with this, it's only because their vaccination rates are at least around 50% of the population or higher. Well, we're nowhere near that.
Are you disappointed, though, on that basis, that there appears to be some members of your own cabinet that think we should be letting this rip?
Look, everybody's entitled to their view. My job is to speak to the facts and to speak to what New South Wales has to do. And I appreciate there'll be many in the community that think we've gone too far. Some will think we haven't gone far enough. But what we need to do is rely on the health advice. And the health advice is based on the most recent data we have. And I just urge everybody to get out of your head. Please acknowledge we cannot live with this whilst the vaccination rate is only at 9%. It is not possible. And I don't think anybody in my position would subject thousands and thousands of people to hospitalisation or death. And I should also say, equally, the economic impact will be devastating. Because if you think you can live with this and it goes wild in the community, nobody will be going to a restaurant or a bar when there's thousands and thousands of cases, thousands and thousands of deaths. Nobody's going to want to leave their home. So I want to stress that the economic impact of trying to live with this is as severe as the health impact. And we know that businesses would much prefer, and that is the feedback to us, businesses would much prefer we stayed in lockdown until we need to, so that we can have confidence that once we come out of lockdown, not only can we be assured of our health safety, but also be assured of economic and business continuity. So our response is as much based on our economic position as well as the health and safety. Health and safety is always obviously top of mind, because if you don't address the health and safety, you cannot address the economic consequences. But we understand and appreciate the economic consequences, but the feedback from the vast majority of business leaders, small, medium and large, is they would much rather we get out of this with zero community transmission, live as normally as we can until higher rates of vaccination are here, and this is part of the roadmap in New South Wales.
This is 7 News with Angie Asimus.
Good morning. In breaking news, there's been another concerning spike in Sydney's COVID numbers. 44 new cases have been recorded, the most in a single day during this outbreak. The Premier says the state should expect numbers to increase even further in the coming days, with 29 people out in the community while infectious. Live now to Paul Kadak in Sydney. Paul, another high number has prompted a further tightening of restrictions.
Good morning, Angie. Yeah, certainly the message from the Premier we've been hearing in the last few minutes is things aren't going well for New South Wales, with record case numbers. Extremely concerned, she said. She also said she needs everybody to be shocked at these new numbers. 44 new locally acquired cases from various parts of New South Wales, not just the southwest suburbs, which have been the focus, but also the southeastern suburbs and western Sydney as well. Even more disturbing, of that 44 cases, 29 of them were out and about while infectious, and that leads to the prediction that those case numbers will go up in the coming days. Now, there are new sites involved, an IKEA, a Kmart, an Aldi. The Chief Health Officer saying the number of close contacts has gone from 7,000 yesterday to 14,000 today. And another worrying figure, the number of people in hospital has risen to 43 people now hospitalised, with 10 people in intensive care care, including someone in their 20s, and there are 4 people on ventilators. Now, it has led to new rules being brought into force. They include any outdoor gatherings limited to just 2 people. Residents are to stay within 10 kilometres of their home. Browsing in stores is now banned. It's something that they've been trying to encourage people to stop doing. Now it is a demand. Browsing in stores is now banned, and from the weekend, funerals will be limited to 10 people. Here's Premier Gladys Berejiklian from just a few minutes ago.
New South Wales is facing the biggest challenge we have faced since the pandemic started. And I don't say that lightly. I don't say that lightly. And unless there is a dramatic change, unless there's a dramatic turnaround in the numbers, I can't see how we'd be in a position to ease restrictions by next Friday. And that is why all of us need to work together.
A very direct message from the Premier this morning, trying to encourage people to try and stop the spread as the Delta variant seems to be getting out of control here in Sydney. Also today, we have seen some hopefully brighter news for businesses that have been struggling through all of this pandemic. The Australian Banking Association says that Australia's major banks have agreed to some relief for up to 98% of small businesses, and that'll include any business that has less than $5 million turnover and has a loan of less than $3 million. They'll be able to defer those loan payments for up to 3 months. They'll also be able to get refunds on merchant terminal fees, the cost of using EFTPOS machines and the like. And people with home loans, they may also be able to waive or defer payments on a month-by-month basis. Some help there for businesses and people with home loans struggling at the moment as New South Wales struggles to deal with the current outbreak.
Paul Kadak, thank you. New South Wales Police are out in force across southwest Sydney this morning in a major operation cracking down on COVID compliance. Live to Amber Laidler in Sydney's southwest. Amber, authorities are concerned about lockdown breaches in that area.
Good morning, Angie. Yes, we heard from the Premier during that press conference the biggest challenge New South Wales is currently facing is a lack of compliance. So 100 additional officers are out in force as part of this high visibility operation across southwestern Sydney today. We've already seen officers on patrol here in Liverpool, a COVID cleaning team handing out masks. Now, the government has listed a number of areas of concern throughout Sydney at the moment. Southwestern Sydney, Western Sydney and Southeast Sydney are on that list. But some community leaders have said that southwestern Sydney is being unfairly targeted.
The reason that we are doubling down so hard in southwestern Sydney over the next week or so is because health are advising us that there are significant areas of contact and areas of concern.
As Paul mentioned, those new restrictions come into effect from 5 p.m. today. The funeral restriction comes into effect from Sunday. Police say they will be out and enforcing COVID compliance, Angie.
Thank you, Amber. There's good news for both Queensland and Victoria this morning. Both states recorded no new COVID cases. It comes as Victoria considers tougher border restrictions with New South Wales, while Queensland has today made QR check-in codes mandatory. Australia will soon be able to access millions of Pfizer jabs earlier than planned in a game-changing boost to the vaccine rollout. Political reporter Taylor Aiken is live in Canberra. Taylor, take us through the details.
Angie, this new agreement will see access to Pfizer doses triple from later.